So you need to know a little bit about this Gerstmann syndrome. The Gerstmann syndrome is a syndrome because it doesn't tell you what the actual cause is. It just tells you that there's a whole bunch of things that could end up with this constellation of findings. That's what that syndrome word means. So the Gerstmann syndrome, I always joke, residents in my clinic often get the Gerstmann syndrome. The reason they get the Gerstmann syndrome is they have a calculi, difficulty with calculations, and so for in the eye clinic, that's calculate the Fabry equation for sed rate, and they can't do it. They have to look it up. Hey, calculi. They have finger agnosia, and that means you don't know what your fingers are. That's such a strange thing. However, in our clinic, I might use my finger like this to mean roll down, and I might go like this to mean to go up, but they have finger agnosia, and they can't tell which one I'm using, thumb or index. They have to be taught. This means scroll down, and this means scroll up. And you got the left-right confusion. And so residents often get this OD versus OS. I say which eye had the RAPD. They say right eye when they meant left eye, or reverse, the left-right confusion. And agraphia. Agraphia means right, can't write. So as opposed to alexia without agraphia, in patients with the Gerstmann syndrome, they have agraphia, they can't write. And that arises from the angular gyrus. And the angular gyrus is your reading center. And because in most people, right or left-handed, but especially right-handed people, that's going to be the left side. And because it's in the processing part of your brain, not the seeing part of your brain, it causes these agnosia problems. I can't calculate, I can't recognize which finger it is, I have confusion between which is my right and left side, and I cannot write. It does not tell you what it is, tumor, stroke, whatever, in that left parietal hemorrhage caused Gerstmann syndrome, the final common pathway for a constellation of findings known as the Gerstmann syndrome.